Hi, my name is Mary Delgado. It is August 24th, 2022. I will be performing my head-to-toe assessment on Miss Rachel Humphreys, who I've obtained consent for. I'm going to scan the room, the ceiling, floors, as I enter the room, I'm washing my hands. I've introduced myself. First, I'm going to inspect the skin. I'm inspecting the color, the texture, the temperature, the turgor, edema, moisture. We're looking for any lesions, bruising, scarring, or nevia in her head, anterior chest, posterior chest, abdomen, and neck. Next, I'm going to look at her head. It is symmetric, midline, and proportional. I'm going to inspect the scalp. I'm looking at her hair, color, texture, and distribution. I'm palpating the scalp for tenderness, lesions, masses, feeling for any deformities, depressions, or looking for any infestations. I'm going to palpate her temporal arteries for any tenderness. Nine. Next, I'm going to palpate her lymph nodes. First, the preauricular, postauricular, occipital, tonsillary, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. Next, I'm going to palpate her TMJ. If you can open and close. Yes, I'm palpating for any tenderness, crepitus, or subluxation. Next, I'm going to assess cranial nerve 5, her trigeminal nerve, by assessing the motor skills of her master muscles, so clenched down. They are intact. If you'll close your eyes, now let me know when I touch in which part of your face.
Cheek, forehead, cheek, chin, nose.
The sensory aspect of cranial nerve 5 is intact. Next, I'm going to assess cranial nerve 7, which is for facial symmetry. So if you could smile, frown, raise your eyebrows, blow out your cheeks, pucker your lips. Facial expressions are all symmetric. Next, I'm going to inspect her ears, the size, the proportion. They are midline. I am inspecting and palpating the pinea as well as her tragus for any tenderness. I'm looking for any lesions or masses. I will use my otoscope to assess the auditory canal as well as her tympanic membrane for any bulging, redness, as well as looking for the light reflex. I would do that on both sides. Next, I'm going to assess cranial nerve 8, the vestibulocochlear nerve, which will first perform the whisper test. If you'll cover your right ear. Can you repeat what I'm whispering?
1, 2, 3.
Now your left ear.
ABC.
Whisper test is appropriate. Next, I'm going to perform the Weber test for lateralization. Can you hear the vibrations midline or on one side greater than the other?
Midline.
Weber test is appropriate. Next, I'm going to perform the Ryan test for air conduction versus bone conduction. Can you hear the vibrations louder in position A or position B? A, B.
A.
A, B.
A.
Air conduction is greater than bone conduction. Next, I'm going to look at her eyes. I'm first looking at her eyebrows, her eyelashes, and I'm looking at her palpable fissures. Then I will begin by looking at the sclera and conjunctiva of her eyes. I'm looking for any lesions or discharge. Then I will next assess cranial nerve 2, her optic nerve, by performing the Snellen test, which is going to test the gross visual acuity. So if you'll cover your right eye, can you read the lowest line possible?
DEFPOTEC.
Good. Left eye?
DEFPOTEC.
Good. Now both eyes open.
DEFPOTEC.
Good. Vision is 20/20. Next, I'm going to assess, I'm going to turn the lights down and I will assess cranial nerve 3, the ocular motor nerve, by assessing direct and consensual pupillary reaction to light. Pupils directly and consensually constrict to light. Next, I will assess for accommodation and convergence. If you can look at this object, I'll follow it forward and back. Eyes converge and accommodate appropriately. Next, I'm going to assess cranial nerves 3, 4, and 6, the ocular motor, trochlear, and abducens nerves by assessing her extraocular motors skills. So if you can follow my movements with your eyes. Good. Good. Extraocular motors skills, movement of the eyes is appropriate. Cranial nerves 3, 4, and 6 are intact. Next, I'm going to look at the internal structures of her eye with my ophthalmoscope. So if you'll look at my right ear, I'm going to look at her right eye, and then look at my left ear. I'm looking at her left eye. Next, I'm going to have her close her eyes. Can you identify the smell?
Alcohol.
Good. Cranial nerve 1, the olfactory nerve, is intact. Next, I'm going to look at her nose. It is midline and straight. I'm going to assess for patency, so blow out. Good. I'm going to feel her maxillary and frontal sinuses for any tenderness. Good. Next, I'm going to look at her mouth and throat. I'm first assessing her, inspecting her lips, her teeth, her gums, her buccal mucosa. I'm looking at the posterior pharynx. I am assessing her tongue. I'm looking at the floor of her mouth. I'm looking at her salivary ducts, and I'm looking at the uvula or her tonsils that she has, and they are 2+. If you can say uvula and soft palate rise with phonation. Cranial nerves 9, the glossopharyngeal, and 10 vagus nerves are intact. Now, if you could stick out your tongue, go side to side. Tongue is midline and moves smoothly without fasciculations. Cranial nerve 12, the hypoglossal nerve, is intact. Next, I'm going to inspect her neck, or her trachea is midline. I'm assessing her thyroid. If you could swallow. Good, her thyroid is normal. I'm going to palpate her carotid furrow pulsations bilaterally, and then with my bell, as she holds her breath, I'm going to listen for carotid brutes. Good. Next, I will begin my cardiac assessment. Actually, I'm going to have her do my posterior chest assessment. So if you could just flip around. I'm inspecting the posterior chest for any deformities and for symmetry. I'm inspecting for signs of respiratory distress, which would be use of accessory muscles, tripod positioning, nasal flaring, tachypnea, cyanosis, or retractions. I'm going to feel for tactile firmness, so if you'll say 99.
99, 99, 99.
Good. I'm going to percuss within the intercostal spaces and all of the lung fields. I'm doing the lower lung bases and the lateral lung fields. I'm going to auscultate, beginning above the scapula, in between the intercostal spaces, side to side, all of the lung fields, the lower bases and lateral fields. I'm going to perform egophony. If you can say keep repeating
E, 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 E.
Bronchophony, repeat 99.
99, 99, 99, 99, 99,
And whisper pec tranquility. Whisper 1, 2, 3.
1, 2, 3.
Good. I've listened to all the bases as well as the lower lung fields and lateral big fields as well. I'm going to have her flip around. I'm assessing the symmetry and any signs of deformity of the anterior chest. I'm felt for chest expansion anteriorly as well as posteriorly. I might have forgotten that. Deep breath, good. I'm going to palpate for tactile firmitas, say 99.
99, 99, 99.
And I'm going to auscultate with my diaphragm. Deep breaths. All right, next I'm going to start my cardiac assessment. I'm going to begin by listening at all 5 valves of the heart, starting with the aortic valve, which is at the right sternal border at the second intercostal space. I'm then listening for the pulmonic valve at the left sternal border, second intercostal space, the Erb's point, left sternal border, third intercostal space, tricuspid, left sternal border, fourth intercostal space, and mitral valve at the midclavicular line on the left sternal border, the fifth intercostal space. I've listened with my diaphragm. I will again listen with my bell, aortic, pulmonic, Erb's, tricuspid, mitral. And then I'm going to palpate or point of maximal intensity at her, and I'm going to auscultate her apical pulse. I'm going to listen for 1 minute, and I'm assessing heart rate, and it is 99 or 66 beats per minute, normal sinus rhythm. As she lays down at a 30 to 45 degree angle, I would assess for JVD a distension and pulsation, and then as she lays flat, I'm inspecting her chest for heaves and lifts. I'm palpating her cardiac valves for thrills, aortic, pulmonic, Erb's, tricuspid, mitral. I'm going to then auscultate again as she's lying flat with the diaphragm and the bell at the aortic, pulmonic, Erb's, tricuspid, and mitral, and the bell, aortic, pulmonic, Erb's, tricuspid, and mitral. Next, I'm inspecting her abdomen. I'm inspecting the symmetry and contour of her abdomen. I will listen with the bell as she holds her breast to her aortic, arteries for bruits, renal, iliac, and femoral arteries. I will then begin with the diaphragm, listening to her vowel sounds. I will start in the right lower quadrant, the left lower quadrant, left upper quadrant, left lower quadrant. Her vowel sounds are normal active. I'm then going to percuss. I'm listening for tympany, dullness, or flatness in all 4 quadrants. I'm going to light palpate for masses, tenderness in all 4 quadrants, and deep palpate for masses, tenderness. None. Okay. Next, I'm going to have you sit up and face back. I'm going to assess CVA tenderness. Any tenderness?
No.
All right, good. If you'll face forward, we'll begin our musculoskeletal assessment. I'm first going to inspect the joints of your upper extremities in your fingers, wrists, elbows, and your shoulders. I'm assessing the for any redness, swelling, crepitus, deformity, lesions, nodules, as well as symmetry. I'm feeling that everything feels normal. I'm going to check her radial pulses. I'm checking the capillary refill on both of her hands. It's less than 3 seconds in her fingertips. We're going to start with the range of motion of her fingers. So if you'll follow my lead, you're going to flex down, extend up, hyperextend back, abduct out, adduct in. Next, the wrist, flex down, extend up, rotate. Now with your elbows, we're going to flex, extend, hyperextend. Now shoulder range of motion, we are going to flex, extend, hyperextend, adduct your arms, abduct, circumduction. We're going to internal rotation, external rotation, good. Next, we are going to assess your strength. So if you can squeeze my fingers, grip strength, 5 out of 5. Now as she flexes and extends her biceps and triceps, that strength is 5 out of 5. Now your shoulder strength, if you can abduct against me, adduct, good, and shrug against. Cranial strength is 5 out of 5, and shoulder, cranial nerve 11, accessory nerve is appropriate, and strength is intact. Next, we are going to move on to cerebral coordination. I'm going to begin by doing rapid hand movement, hand flip-flop. And we're going to do serial finger opposition. And if you can touch your finger to your nose, now to my finger, to your nose, now to my other finger, now your other hand, finger, good. Finger to finger is appropriate. With the serial finger opposition, we also checked thumb opposition of finger range of motion. Next, I'm going to just assess her upper and lower skin extremity. I'm looking at the color, warmth, integrity, and looking for any edema in her upper and lower extremities. None is noted. And if you'll close your eyes, tell me if you can feel this light touch.
Yes, 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 yes.
Light touch is intact in our upper and lower extremities. Next, can you close your eyes and identify this object in your hand?
Coin. Paperclip.
Good. Stereognosis test is appropriate. Keep your eyes closed, palms out. Identify this letter.
A.
Number.
3.
Graphesthesia test is appropriate. Next, I'm going to assess vibratory sensation in her proximal ulnar prominences.
Yes.
Can you feel it?
Yes.
Good. And your medial malleoluses?
Yes.
Good. Next, I'm going to assess the deep tendon reflexes. First with the brachial radialis. Good. Tricep. Now with your arm up against my resistance. Tricep. That was bicep. Now this back here is tricep. Patellar. Achilles. Babinski. I would do that on both sides bilaterally. Next, I'm going to move on to her lower extremities. Here again, I'm looking at the toes, ankles, knees, hip joints. I'm looking for any signs of redness, swelling, deformity, crepitus, nodule, lesions, edema, tenderness, and I'm looking at the symmetry. I'm going to test the capillary refill of her toes, less than 3 seconds, assess the dorsalis pedis pulses, and inside the posteriotibial pulses. I'm going to assess the range of motion of your toes, so if you'll flex your toes down, extend up, hyperextend, abduct them out, adduct them, and next the range of motion of your ankles. Dorsiflex down, plantar flex up, inversion, eversion, and rotate your ankles. Next, I'm going to test the strength of your ankles, so dorsiflex down, plantar flex up. Good. Ankle strength 5 out of 5. If you'll extend your knees, Flex your knees, knee strength 5 out of 5. Abduct your hips against resistance. Adduct, hip strength 5 out of 5. If you can stand up, we are going to assess your knee range of motion. So flex your knee, extend, hyperextend. Now we're going to assess the range of motion of your hip. So you're going to flex your hip, extend, hyperextend, abduct, adduct, internal rotation, external rotation, and circumduction. Next, you are going to lean this way. I'm going to assess the spine. I'm looking at symmetry, alignment, curvature, looking for any signs of tenderness or scoliosis as she lumbar spine flexes forward. No signs of scoliosis. She's lumbar flexing, so stand up straight. You're going to extend, hyperextend back. Now go face forward. Your lateral flex side, and then rotate your lumbar spine. Lumbar spine range of motion is normal. Next, we're going to check cervical spine range of motion. So flex your neck down, your extend up, hyperextend back, lateral flex side to side, and internal rotation, rotate. Next, I'm going to perform the Rollenberg test. If you could stand there, eyes closed, arms out forward, there's no swing. Appropriate Rollenberg test. Now test gait. You take 5 steps forward. Gait is steady and balanced. Turn on, now heel to toe. Gait is tandem and symmetric. Next, we're going to check balance by hopping on one foot and the other foot. And balance is appropriate, and that is the end of my assessment.